Welcome back to a new episode of Hello, I'm Listening.
You were about to say Translating Love.
I still have to get used to the new name. But it's an exciting episode.
It is an exciting episode.
Because we have
our first guest.
And it's not only a standard guest, it's basically the first.
What is a standard guest?
You know, like our guest that comes in once in a no, not we. That's the guest that we have the second time on our, not on this podcast, but I mean technically it's the same podcast. Let's be honest, it's just a different name. But yeah, welcome Shannon. Welcome.
Hi, thanks for having me on again.
Yeah, it's so good to have you back, and thank you for obviously doing our show again, because it's not, it's your time, so we appreciate that you come on. And yeah, also, I mean, we as I just was saying before, this very
weird rant that you're on.
No, but this very natural intro that just was very natural. We were just talking about the topic, or I was just going to explain why I thought about this topic. And the topic today is healthcare systems comparable from Austria, the UK, and the US.
Yeah.
But not in we're not professionals. I don't work in the healthcare system, so I only know what I know from living here.
And I work in the healthcare system, but in Austria, so I have no work experience in the healthcare system in the US. So
right.
And I'm also just speaking from personal
experience. Shannon, you're not a professional either, right? You're just a citizen.
Absolutely not, no.
Yeah, good. But that's perfect, because that's like the pure experience and how we perceive the healthcare system, and maybe how it's changed through our lifetime.
Mm-hmm.
And what I just want to say is that every time we are in the US or someone from the US is over here, we somehow always talk about the healthcare system at some point. And it's so mind-boggling to them that a lot of things that we are getting for free is massively expensive in the US. But maybe let's start with that.
Oh, we're starting with the US.
Yeah, maybe let's start with the US. Because it's just interesting.
Yeah, I mean, it's kind of a black hole of nonsense in the US.
Yeah.
But I mean, from my perspective, and I've read a little bit, but it basically, the system that we have in place in the US is that it is very employer based. So your employer pays for your health insurance to an extent. And so, but they don't have to. So it's basically your employer decides in a exaggerated way if you live or you die.
Okay.
Because
that sounds horrible.
I mean, but if you think about it, if you were to get cancer, depending on what job you have, you're either going to survive it or you're not. And that's completely
you have
crazy.
A massive debt because you have to go
Exactly.
in debt.
Exactly.
Yeah.
And some employers don't offer insurance. Sometimes you have to pay for it out of pocket. Some employers offer, they pay for part of your insurance and you pay for the other part. And it's just a wacky system. A lot of hospitals and insurance companies are funded by big corporations.
Oh, yeah.
A very small percentage are nonprofit. Very, very small percentage, even more so than the nonprofit, is by government funded. So it's like kind of it seems backwards.
So I think that brings us already in the big problem that if you make healthcare private, then the person is not the middle of the whole thing anymore, but the money is, or the
and basic things people can't afford. My best example, I always give this example, is when I was on my mom's plan until I was 26.
Yeah.
And when I was about 19 or so, we had to switch insurance companies. And there's this weird, or there was at least at the time, this weird rule that you couldn't have like a 6-month overlap or something like that between insurance companies. So we didn't have insurance for 6 months.
Oh, yeah.
Basically. And so my mom was like, we have to be extra careful because
you always
we didn't
see
have
that
insurance.
in movies and shows where they're like, oh shit, I forgot to pay the insurance.
Yeah, and now you just don't have insurance.
Right, and this weekend we have to be very careful because I can't pay until Monday.
Yeah, because there's also like some insurance companies say that you can only pay on the first of the month. So if you miss it, then you have to wait until the next first of the month.
Crazy.
It's crazy. But
what if you have an accident?
Yeah, it's nuts. And so our insurance was just like on hiatus for a while.
Yeah.
And I went to the pharmacy to get my birth control pills.
Oh, yeah.
And they were like, oh, you don't have insurance. And I was like, no, but I was just going to pay it out of pocket. I mean, it can't be that expensive.
One would think.
1 month, they asked for $120 for a month of birth control.
Wow.
And I'm like, what? And even with insurance, I was paying $30 a month, and that's with insurance.
So compared to Austria, in Austria you pay?
I paid 12 euros for 3 months.
And what is it in the UK? Do you have like numbers to compare to that?
Yeah, so we have to pay for medicine and prescription. But if you get it on prescription, so if your doctor prescribes you that certain medicine and you go to the pharmacy, it's £9.35. So that's what for one single prescription. So that could be antibiotics or birth control, etc.
Ah, I see.
Everything would be £9.35 for one prescription. That seems to go up a lot. So probably about 5 years ago, it might have been £8.12. As time goes on, the price inflates. So for one single thing, so if you needed 2 prescriptions, it would be £9.35 times by 2.
Mm-hmm.
Okay, got it. So, but it doesn't matter what you get prescribed. It can be anything. So it could be something that is worth less technically, but you still pay that amount.
Yeah. So if painkillers, for example, paracetamol or ibuprofen, they tell you to just go to the shop and buy it because it's like literally 50 pence rather than getting it from the doctors for £9 odd. You could get like 100 boxes from the shop due to the amount that the actual doctors charge you for the prescription from the pharmacy. So for some things, you are better going to like the supermarket and just getting some painkillers from there. But yeah, depending on, even if it's a super expensive drug or medicine, it would still be £9.35 per prescription.
Mm-hmm.
Oh, wow. Okay. But going back to, so when you are insured in the US, what like if you go to the doctor for like a checkup, for example, like you get your blood drawn and you just want to do a checkup. Yeah. How is that?
It's again for everybody different. And that's what's also so crazy about the whole system is that depending on what insurance company you have, depending on how much you decide that you can afford to pay a month for your insurance. So basically that is dependent on how much you pay at the doctor, or in some examples, like my mom has a copay. So when we would go to the doctor, we had really good insurance, or what qualified as good insurance, and we still had to pay, I think, $30 or something just to see the doctor. So at like upfront, you just pay $30 and then you can go see him or her.
You pay up front.
Yeah.
At the like an entrance fee.
And they might only talk to you for like 10 seconds, but it can be 10 seconds, it can be 20 minutes, and it won't matter. And God forbid they do anything else like x-rays or anything else, and then you pay for so much. And in my mom's case, she has a prosthetic leg, and so she needs a lot of checkups. She needs to once in a while get her leg checked out or replace the knee, and it's thousands and thousands of dollars. And
even though she has a good insurance.
Though she has good insurance, and the insurance says, we'll only start covering you after you've paid something like $3,000 in a year out of pocket. So it's like, who pays $3,000 a year out of pocket to go to the doctor?
That's so crazy.
It's nuts.
It makes no sense to me.
Yeah.
I mean, that's a total other topic. But for example, with medicine, I mean, when you get medicine, the medicine is like priced by the manufacturer, and there's no limit on the whole thing. So basically the manufacturer can say, okay, we charge the people for that medicine that amount, even though it might be life-saving. For example, with if you have diabetes, what is it called? Did you need?
Insulin.
Insulin, yeah. And that's so crazy with that. I mean, it's so I don't know what the numbers are, but it's so expensive that people try to get it from like Canada, where it's super affordable.
In Mexico, and it's nuts.
It's so crazy. But okay. But how is the system in the UK compared to like the US? I mean, we talked a little bit. It's comparable to Austria a little bit, but how does it work in the UK, like the healthcare system?
So it's free on point of contact. So if I rang the doctors up and to book an appointment, I could just go to the doctors and see a doctor for free. But so it's government funded. So the government funds the healthcare system. The national healthcare system. It's called the NHS. So technically, we do pay for it through tax. That we get taxed when we get our wages from work, but that portion goes to the government, and then the government obviously uses the tax on police, fire services, things like that, and then part of that also goes to the health service. So if I rang my doctor up and then he had to send me for a blood test, an x-ray, an ultrasound, that would just be free. I could just go get that done. I wouldn't get a bill or anything, and that would be it. So I suppose it's good when you obviously say it like that and you are getting a lot for free, but also you are paying for it technically through tax, but nothing sort of compared to America, where it's thousands of pounds. It's just obviously a percentage that comes out of your wage every week, every month that you don't see. But for example, my mum's got diabetes and she's on insulin, and she doesn't have to pay that ridiculous amount for insulin. Obviously, she just gets that. And certain people qualify for free medicine, so they wouldn't have to pay prescription. So whereas I would pay £9.35 for a prescription. If you're unemployed or certain criteria, you would be exempt from paying. So certain people in the system don't actually have to pay for medicine, so they wouldn't have to pay that prescription fee. If obviously like children as well.
That's similar to Austria.
So in terms of like actually accessing and seeing a doctor, it is free to do that. All the procedures that I had done, obviously I had a lot of surgeries as a child. I had the transplant from my feet to my hands. All that was free. And I also went down the road of prosthetics as a child to get some prosthetic feet for my limb difference on my feet. And, you know, accessing prosthetics and things like that was free as well through the national health system. So yeah, I suppose it's really great when you think of it that way, but our healthcare system is sort of really struggling at the moment because it's understaffed, underfunded. Everyone's very stressed who works in the system, so people are leaving the system, so there's not enough staff. You can't get appointments to see doctors. The waiting lists are just so bad, you know, months and months just to get certain procedures done, not even sort of invasive procedures. So yeah, it's a great system, but it is sort of collapsing in front of us, and that's what we're really worried about here in the UK.
Talk quickly about your recent experience with setting up a doctor's appointment.
Yeah, so I try my best to avoid the doctors because sort of the past few years it's been super hard to get a doctor's appointment. Obviously with coronavirus, doctors closed the doors in terms of seeing doctors face to face unless it was absolutely necessary. So everything was sort of done through telephone calls and things like that. But, you know, things have settled down a little bit with the coronavirus in the UK, but it is still extremely hard to get to see a doctor at the minute. So I called the other day to speak to a doctor, and it took me 150 attempts to just get through to reception.
That's so crazy.
So that wasn't even to speak to a doctor, that was just to speak to the receptionist at the doctor's surgery and try to book an appointment. So even when I got through, there was no guarantee that I would actually get an appointment because So you can't actually book in advance in the UK, or not with my doctors anyway.
Mhm.
You can't ring up and say, can I have an appointment for Friday afternoon at 3 o'clock? You've got to ring every morning at 8 a.m. and then just hope for the best that there's an available appointment that day.
Wow. Okay.
So, it's standard practice that you ring at 8 a.m. when the phone line's open and when the doctor's surgery opens, and then just keep ringing and ringing and ringing until you can get through.
That's crazy. Isn't there like an option for email appointments? Because a lot of doctors here are doing that now, where you can just send an email and then they get back to you when they have time.
So some doctor surgeries, I do believe, have like an online system,
Okay.
but my particular surgery do not have that. So I am in the process of trying to change doctors, because when I've spoken to people about my experience with my doctor's surgery, people have been quite shocked that it is so terrible. So yeah, it is very stressful, and it's also puts you off ringing because you know how long it's going to take to try and get through. You're not guaranteed an appointment anyway. So I only ring the doctors now if I like truly am desperate to speak to a doctor. But I have been known to sort of turn up at the doctor's surgery and queue outside before it opens, for when it opens at 8 a.m. to sort of join a queue to like desperately speak to the receptionist in person. And then obviously people so far down the line get turned away when all the appointments are gone for that day. And then they have to just come again the next morning, queue up and hope for the best.
Wow.
So it's really not a great situation here at the minute. And people, it's been like this for quite a few years, even sort of before COVID. Doctor surgeries were like this, but it's just got like significantly worse since coronavirus has sort of come around.
You would think that with COVID, people learn and see and appreciate the medical field more, and the staff and the people, and also the government, like, hey, look how important those people are for our society and for our I mean, it's basically an important structure in every country.
I think it's gotten worse because just from my own personal experience, I don't even work in like a hospital setting, but I work at a doctor's office, and we are treated like garbage by a lot of patients who come in.
Yeah,
they're they're so entitled. They're instantly rude. They are very impatient, and we're always super friendly with them, but we a lot of times just get treated like complete garbage. And I feel like it only gets worse as the pandemic continues to continue.
That's a good point. I think a lot of people, I mean, compared to you in the UK and the situation in the UK, we have it so much better still right now here.
Yeah.
I mean, it's getting worse by every year, basically. And it's the same here, that people are getting more frustrated in the medical field, and they're like, okay, I'm quitting, I'm stopping. They're underpaid. People, patients are really not nice. A lot of people are very rude and impatient. And a lot of doctors are leaving too, because they're saying, okay, I can't handle the stress and this constant pressure anymore, because there is no help from the government.
Yeah.
And I mean, for example, it's the same here. If I want to go to the doctor, I can either call the day and say, hey, I need an appointment, and they can say, okay, maybe we have an opening here, if I'm lucky, or I get an appointment next week or in 2 weeks. So the waiting time is not considerably long.
It depends on what kind of doctor you go to. Yeah.
Yeah. Sure. I'm talking about like a general practitioner.
Yeah.
But for example, if I can also queue, I can go to the doctors at 8 or 7:30 when they open, and queue in line and hope that and usually that's a thing. I can usually stay there.
Most general practitioners will see you if you just walk in.
But also it depends. I mean, sometimes you have to wait 2-3 hours, but yeah, it's considerably less. Yeah. But what's so horrible is that a general practitioner basically has so many people nowadays, especially on the countryside, because they're getting less and less so, and like new doctors are not coming out of the system or not out of universities because they're missing.
Yeah.
And so they're already
and
very stressed.
With
doctors.
that, a lot of general practitioners are becoming, instead of they're going into private. I don't know how you would say it in English. Private practice, right? Instead of they're, I don't know, paid for by the government,
right. So,
and they're not getting paid well enough. And with the pandemic, it's too crazy.
That's what I wanted to say. So we basically have a 2-class system here in Austria, where you have like the normal regular insurance, like you in the UK, where you like a bit of your paycheck gets paid towards the health insurance, right? And then you can go to see a doctor, or not every doctor, but the doctors who are in the system of the social security. But that's becoming less and less so, because again, the government is not helping those people. The payment is not great. The stress and the amount of patients is increasing like crazy. And compared to like private practice, you make so much less money. And so the next step for a lot of doctors is, okay, I'm becoming a private doctor, and you can come see me and pay the money and maybe get something back if your insurance allows that. Or maybe you have a bad insurance, like the private insurance, and you maybe come here for free even. And that's the next thing, that the system is built, or was built into being more of a 2-class system, where, I mean, it is already. So compared, for example, if I have a private insurance, I can probably get like a non-life saving surgery, like something that can be, in a year as well, in 2 weeks. Compared if I do that without a special or like an additional insurance, then I have to wait probably a year or half a year, something like that. And that's so crazy. That's so crazy to me, that the people who are already rich and, they have more of, a normal citizen who doesn't make a significant amount of money, gets better treatment in healthcare, which is kind of fucked.
Yeah.
And if you look at, the UK, I mean, my understanding is that that's something that is happening in the UK too. I guess when you have a lot of money in the UK, then you can probably get better healthcare, right?
Yeah, so we have private hospitals, private doctors as well. But obviously it's sort of completely unattainable to people who are just working class citizens who can't afford to pay that level. So I had a quick look. So obviously I've never gone private. I've paid for private therapy before, but not sort of medical like healthcare. And for one consultation with a doctor for 30 minutes is £99. But I think it can literally stretch up to around £400 for 1 hour to see a doctor. So that would be sort of towards London area. That's obviously considerably more wealthy. So I'm based sort of in the north of England, which is typically sort of less wealthy than London. London's where all the rich people are. So yeah, it's very expensive to go for private healthcare, and so obviously there is that option there. If you can afford it, you can obtain better healthcare by paying for private healthcare, but again, that is like extremely unattainable for the majority of the people that live here in the UK. If the NHS wasn't here and it sort of collapsed at its knees and was no longer available, a lot of people would struggle. I know a lot of people now, people have been dying from cancer and things because the waiting times for surgery and treatment is just gone beyond what it should be, and people are obviously starting to die. So it's very serious, and it's just scary, to be honest, for people who can see it happening but feel like they can't do anything about it.
But why do you think, what is, in your opinion, the main reason, or what was the main reason that the funding or the healthcare system was dismantled? Was it just because of funding or lack of care by the political parties, or what is it that like, in your opinion, what happened there?
In my opinion, obviously I don't know, but I think it's because it's just lack of funding. It's someone who works as a supermarket driver earns more money than a typical nurse in the healthcare system. So it would actually benefit those people who work in the system to actually quit their job and go and work in a supermarket. Because of the pay difference and how much they're getting paid and what they're actually doing and the amount of stress that they're under, the amount of emotional stress as well as like sort of physical exhaustion, for the amount of money that they're bringing home at the end of the month just doesn't match up. So a lot of people are leaving. Obviously, because a lot of people are leaving, there's less people that can give you the care. So waiting times just get longer and longer. And it's just sort of that mentality at the moment where doctors are so exhausted. They wake up in the morning, come to work all day, go home late at night, go to bed, do it all again the next day. I mean, even doing that in sort of an office job like I do, I don't think I could do that. Never mind sort of performing surgery when you are so exhausted and you're probably not in the right frame of mind to even be doing the job because you're overworked and underpaid. So there's just a lot of flaws in the system, but obviously I think it comes from the very top at the government. They are the people that pay the employee wages, and who fund the system, who give all the equipment and everything. So that's sort of, I think, to get to the root of the problem, something is going on at the top of the system that needs to be sorted out. But we have a Conservative government in at the moment, which are obviously all very wealthy people, who probably have private healthcare, who have never stepped foot in the National Health Service, so they wouldn't know what it was like in the National Health Service. They've probably never been treated or seen a doctor that works within the National Health Service, so that they probably don't actually understand the severity of what's going on at the moment in the NHS and sort of how much it's struggling. Even though there's so many protests, so many people trying to raise awareness, it's just like they're not really bothered. They don't want to listen. I don't know if you know much about the UK Prime Minister.
Yeah, we do.
So I think you only have to take one look at him to see that he's not fit to be a Prime Minister at all. And so much stuff has come out about him, and I'm completely baffled as to how he is still our Prime Minister. But it doesn't give the people, or the majority of people, faith in the UK that things are going to get much better whilst he's sort of in power. And he's got the decisions, or the main decisions over sort of what goes on with the NHS. But yeah, obviously someone's voting for him, otherwise he wouldn't be there. But it's concerning, really, to think that a man like that can be in charge of a country.
Yeah, especially when you look at the UK from the point where it exited the EU and how it just went down, the whole thing, and he's just one of the worst people. Like the things he says, the things he does, he lied so many times, and people seem to don't give a shit, or I don't know how that man is still there. It's mind-boggling.
Yeah, you can ask the same thing about Trump, though. I mean, it's very similar.
I mean, they're the same. That's the same. I think
very
Trump
similar mindsets. I think in terms of the people that follow people like that.
Yeah, definitely. I don't know what needs to be done for him not to be sort of Prime Minister anymore, but yeah, it's concerning, especially when there's so much news that comes out about him lying about certain things. I mean, during coronavirus lockdown, he broke all of his own rules. He had family, and it's just like, how can this guy still be in power and people are not sort of protesting and uprising against it? It's worrying, really.
Have you noticed, just with your government being more conservative at the moment, have you noticed in the healthcare system more discrimination against people of color or people who maybe don't speak English that well, just in general, those people who are trying to get healthcare services? Have you noticed any?
Or even you yourself?
Yeah.
To be honest, Not really, but that's because the Conservative government have been in power for such a long time. It's probably so far ingrained in the system that it's not sort of a dramatic change that you've been able to see, because it's been something that's just been going on for years. So obviously before Boris Johnson, there was so many other prime ministers that were also in charge of the Conservative Party that were our prime minister. So the Conservatives have been in for quite a long time, but I don't doubt that that is absolutely a problem here in the UK. I know from the things that I see, the things that I hear people say, that there is obviously a big problem with discrimination, racism, everything like that, prejudices. So I don't doubt that that's a problem. But sort of around my area in particular, it's very much sort of white British people. There's not many people from ethnic backgrounds. So personally, from my point of view, I haven't sort of seen that firsthand or had accounts from people who have said, that X, Y, and Z have happened to me. But I can completely sort of sympathise that probably does happen, sort of in areas where there is people from ethnic backgrounds that are struggling. I wouldn't say that I've personally had that either, because, like I say, I tend not to go to the doctors because it is such a stressful ordeal, even trying to see a doctor. But it also, last year I went through quite a few procedures trying to figure out and get a diagnosis for endometriosis. And that was just a whole ordeal in itself. The doctor who gave me a call after my procedure to discuss the results with me didn't even know who I was or why she was calling me, even though she was the one who did the actual procedure. So when she called and she said, how can I help today? I was like, well, you've called me for a start, and you're supposed to be giving me the results of the procedure. And she was like, oh, where did you have the procedure done? And I was like, you did the procedure.
Wow.
You tell me. So yeah, that was quite concerning at the very start of the conversation, that she'd obviously not looked at the notes before she'd given me a call, and she obviously had no idea who I was. And she said, oh yeah, everything's normal, everything has come back absolutely fine. Which I know myself, your own body, when there's something wrong, when something's not right. So obviously I expressed my dissatisfaction with her answer, and that obviously there was something that needed to be investigated. And she then asked me what I thought the next steps were. And I was like, well, in your professional opinion, I think that's your job to tell me what the next steps are.
Right.
Yeah. So her advice was just to put me on birth control, which I'd said before, I do not want to be on birth control. I've been on birth control previously as a teenager. It doesn't agree with my body. I've done lots of research into birth control, and personally,
I don't think it agrees with anybody's body.
No, I was like,
and it's so often the case where they say, oh, you're having these problems, birth control.
Yeah, exactly. So I did express, I do not want to go on birth control. To which her reply was, oh no, don't worry, it's not to stop you from getting pregnant, it's to stop your symptoms of endometriosis. But I said, I don't even have a diagnosis of endometriosis, so you're treating me for something that you don't actually know that I've got. That's why I'm wanting these investigations doing. So yeah, I asked for sort of a laparoscopy where they go into your womb and see sort of what's there, and she basically outright just sort of refused and said, we're not willing to do that at this point. But this has been going on for sort of 5 or 6 years. I've had procedures done before, and I was told that this would sort of be the next step. And when it got to this point, she basically said, we're not willing to do that. The only option at the moment that we're willing to try for you is to put you on birth control. And if you're not willing to do that, well, that's what we're advising. So yeah, very stressful. I ended up crying on the phone through frustration.
I would too.
Yeah.
It's so frustrating. It's feel like you're not getting your voice heard, like nobody actually wants to help. So yeah, it was a very stressful time last year trying to sort of get it sorted out. Still no further along, but that's just sort of the standard thing that's happening at the moment. And I know a lot of people have experienced things like that. But it's just sort of one of the things where you think, well, what can I do because I can't afford private healthcare? It's really hard at the moment.
Yeah. Oh, I'm so sorry. That's so frustrating. And especially anything to do with just feminine health in general can be so stressful. And when things aren't working how they're supposed to work, I also had a lot of procedures done in the last few years because of problems I was having, and ended up being diagnosed with PCOS, which is kind of similar to endometriosis.
What is endometriosis? Can you quickly can any of you guys quickly explain it a little bit, because I have no idea what it is?
So endometriosis is basically where the endometrial tissue from the womb sort of grows outside of the womb, and it can attach itself to sort of your bowels or other organs. Yeah, so it's quite painful. So
yeah, it sounds painful.
You have really painful periods, and really you have a really hard time with a lot of things, and it can affect fertility. And
that sounds horrible.
It's quite serious, and it's like majorly sort of under. People don't really get a diagnosis of it because doctors just don't look out for it enough, and they're not willing to put you through the procedures. And not a lot is known about it. So women tend to try and get a diagnosis for around 7 years before they're actually diagnosed with it, because it's often put down to other things such as IBS and things like that. So it's very frustrating, and they basically try and put you on birth control to try and sort of make the symptoms better.
Which is so crazy, because it might help with the symptoms,
physical symptoms,
but it doesn't fix the problem. And in turn, what I've read, at least, it can make, at least with PCOS, it can make symptoms or make the actual thing worse because of the hormones that you're pumping into your body. And it's just, it seems so backwards that for every problem from when you're 15 years old, they say, oh, you have acne, take birth control. Oh, you don't want to have painful periods, take birth control. Oh, you want to lose weight, take birth control. Or it's just like, why? It's not a solution. It's potentially making the problem worse.
Yeah, they're treating the symptoms rather than the root of the cause. Yeah, that's crazy. Okay. Yeah, I'm so sorry is that still a thing that you have to deal with, or is that something you already sorted out?
Yeah, so it's been something that I've been dealing with sort of for, I think the first time I went to the doctors must have been 2015.
Wow.
Obviously, we're in 2022 now, so it has been a long time. But yeah, it's still something that's going on. It got to the point with the doctor where I said, right, I'm willing to try birth control for a certain amount of months, and if there's no change, then I'm going to have to come back. But I didn't have any intention of actually going on the birth control. I just sort of said it to sort of tick that off the list and say it's something that I tried, because they weren't sort of giving up and willing to sort of move forward with any other options until I'd said that I tried birth control. So I got the prescription that I had to pay for the birth control, but never took the birth control because, I mean, I've been on multiple ones before. I know my body. I know it doesn't work for me. So yeah, that was literally just to satisfy sort of a tick box on some doctor's notes to say that I tried it. And I'm still sort of in the process now of dealing with the periods, but again, because of all this in the past and because it's been going on for so many years, it's sort of in two minds of, I don't really want to ring the doctors because can they help anyway? And on the flip side being, well, no, I really do need to ring the doctors, but can I be going through all this stress at the moment? So yeah, it's something that is on my to-do list, but it's finding sort of the emotional capacity to go ahead and try and go through it all again. So yeah,
it's so crazy. Things like that show that like a well-funded governmental healthcare system is so important. And if you compare like Austria to the UK and then to the US, it's like Austria is still like pretty good. Like we are very lucky what we have still.
Oh yeah.
Even though you see the system crumble and people leaving, obviously, because of the conditions and because of the stress and also because of the horrendous things they've seen during COVID. I mean, there are so many documentaries and just TV interviews out there from nurses who say they have never closed so many body bags during the time. And, it's a horrible time still that we're in, and it's not over. But the thing is, when it's over, I mean, those people have to work through all the trauma. And I mean, that's not easy to just cope with. And then you have the UK, where it's like in the middle of Austria and the US, in the sense where you see, okay, the system is already very, very disturbed. And if you have money, no problem. But if you don't have money, you can't get a hold of a doctor. I mean, if you're lucky, you might, but it's very hard. And then you have the US, where it's all about money, and it's all about how much you pay in every way or sense. I mean,
but it's with everything too. I mean, when I first moved here, I wouldn't go to the doctor because in the US I had such a mindset that I wouldn't go to the doctor unless I absolutely needed to, where it's like, I don't know how I'm going to get up in the morning unless I go to the doctor. And otherwise I wouldn't go because I couldn't afford it. And typically they don't tell you anything anyways. If you're sick, you're sick. They're like, oh, you have the flu, or, whatever. But when I came here and I would feel sick, he had to like push me to go to the doctor. He's like, just go to the doctor. But it was so drilled in my brain where I was like, I can't afford it. I'm barely working. And he's like, you don't have to pay for it. Just go. And it's just, it took such a long time. And I think I still have a bit of that mindset because I still push it off most of the time if I don't need it. It's just so drilled in my brain. But if you think about women who have children, if you give birth in a hospital in the US,
I just wanted to say
you are in debt for years because it costs thousands of dollars to have a child. I mean, you don't want to stay in the hospital for a day because God forbid you need to stay 2 nights or 3 nights. I mean, it can be like $30,000 to have a child.
Really?
It can be pretty expensive.
Oh, that's crazy. How is that in the UK? In the UK, it's still free, I guess, right? Or at least
so still free. You actually get paid from the government. I think child tax credits, it's called, I think. So you get a certain amount.
We have that in the US now too. They just started that.
So to actually have a child, everything like that is completely free with the NHS. So you wouldn't have to pay to have a baby. I can't get my head around the fact that in the US you have to pay to have a child. Like,
that's so crazy.
Yeah. It doesn't matter.
I just looked up an average cost. The average of recent average cost, the average price of having a baby through vaginal delivery is between $5,000 to $11,000 in most states.
That's so insane. And that's so crazy. So that's something that it's not like, you have an accident and that's something that that happens and you have to go to the hospital and you can't say no to that because otherwise you would die on the street. But with a pregnancy, I mean, that's something.
And that's without complications. You think if there are complications, you could be up to $30,000.
That's so
for
crazy.
Something that's out of your control.
I did see somewhere that someone had put on the internet sort of a copy of their bill from giving birth, and they charged the mother for skin-to-skin contact after the baby was born.
What?
Yeah, that's just absolutely insane.
Yeah, because there's a person giving the baby to the mother and taking it away again. That person has to get paid.
Exactly.
Oh, wow. That's so crazy.
Yeah.
Oh, man.
It's pretty nuts, though.
So, yeah, what I mean, again, I think it's so important that we cherish and try to enforce the government to keep free health care, because that's something I think a lot of countries, I mean, especially the US, has not gotten yet, that if people are healthy, and I mean like physically and psychologically, the country itself is in so much better shape.
The economy alone would be in better shape because people would be okay working. They would want to work. They would work longer.
Yeah, and with that comes happiness. I mean, if I'm healthy and if I have access to treatments, I'm more likely to be happy because I don't have to worry about dying.
But what's interesting is that the US, they do get that concept, but clearly not with healthcare. Because if you think about, if you have a fire, right? Your house is on fire. Yeah. The fire department comes and they don't say, oh, sorry, we just looked, you're not covered, so we're not going to put the fire out.
Yeah,
I mean, that's not how that works. Or a lawyer. Everybody has the right.
$2,000. Otherwise, we can't.
Yeah.
We can't.
Everybody has the right to the access to free to a free representation.
Yeah.
If something happens where they're arrested, you get free representation from the government. Okay, that's something that works in your favor as a citizen.
Yeah.
Teachers, you get taught in school. You're not paying for that. That's government funded.
But that's exactly why.
So they get the concept.
Is still so much in terms of it's all about the money. It's all about how much money can they generate, and it's starting from a hospital to pharma industry. It's all about that. And unless the people are in the center of the whole thing, it's always about money. And then it's always about, okay, how much can we charge people for certain services? And if it's just skin to skin contact after giving birth. Oh, wow.
If it's just let me hold my baby after I give birth.
Right.
We can charge them $1,000 for that.
Oh, man. Yeah.
Yeah.
We kept you way too long. That was a very interesting and not so fun, but also, I don't know. Engaging talk. So we very much appreciate you being here with us.
Oh, no problem.
And I hope you will be back at some point.
Yes, definitely. Anytime. I'm happy to have a chat with you both.
Okay, then have a great day and until next time. Oh, before I forget. We will link all your social media in our description. We have a great episode with Shannon out about her limb difference, and it's one of my favorite episodes from the podcast we did. I'll link that too. Is there something else you want to say to the people?
Thanks for listening.
Okay, then bye.
Bye.
Well, that was a cool episode.
Indeed.
Very, very nice to have Shannon back for the second time, second guest.
And interesting to hear other perspectives from other countries about how their system works and just seeing how different it is in a place that's also so forward thinking.
I mean, Western, very, sure. The concept of the thing is you live in a country, you grow up in a country, and you learn how to adapt to the system, whatever it is, and you think it's normal. But once you look outside of that, once you broaden your view and once you travel, maybe or talk to people from different countries, you see that maybe the system in our country is not as good, or maybe our system is great and people in different countries have an awful system. And I think it's all about that, because how can we as a society, not only in our country, but as a whole society and the world, have a better life and provide people with the necessary healthcare? I mean, the big thing is to just look at different countries and see how they do it, because it's possible. Yeah. And there are better systems out there than Austria. Like if you look to Scandinavia, they have amazing healthcare systems. And yeah, that was a cool episode.
Yeah. Agreed.
Other than that, please like, follow, subscribe, share the podcast. We really appreciate that. And if you want to send us a message, you can do that on our Instagram, via email, or on Anchor with voicemail, and we can put you in the podcast.
Indeed.
Goodbye.
Goodbye.